Makerere University Department of Biosecurity Ecosystem is to train 15 masters and PhD students to carry out researches on Ebola and other zoonotic diseases caused by interaction between animals and humans. This follows the deadly Ebola outbreak in West African countries with a death toll of over 2,500, which according to experts could cripple the economies of the affected countries. The 5-year program, which starts this academic year 2014-2015, draws students from areas of agriculture, veterinary medicine, wildlife, among other courses. The 6 billion shillings program, courtesy of the Norwegian government, is intended to build capacity to handle Ebola and other emerging diseases that continue to claim lives.
All this is aimed at understanding and mapping out strategies of looking at what are the zoonotic diseases in these 3 respective countries. How do they impact onto the communities in the various regions of the low-income countries, where Uganda, Zambia, and South Sudan falls? It's a program that has master's and PhD training opportunities, with research being one of the key focus.
Speaking at the Ebola and Zoonotic Disease Conference in Kampala, Dr. Clovis Kancha, a senior lecturer at the Department of Veterinary Biosecurity at Makerere University, observes that Ebola can be contained if stakeholders from Ministry of Agriculture, Defense, Internal Affairs, Health and Wildlife authorities work together.
We would like to see how do various stakeholders engage and provide contributions in terms of leadership, in terms of responsibility, in terms of collaboration, see that we strengthen partnerships and see how to address these ravaging diseases, not only in this country, but also in the region.
Professor Olonzi Ojok says Ebola is an invisible deadly disease which mainly affects and destroys the liver and other sensitive parts of the body. And to Professor Olonzi Ojok, a veterinary expert, says that unless African countries build capacity to contain the deadly disease, more people will continue dying as the cases remain in Liberia and other West African countries.
Reticular fibroblastic tissues and in the liver, in the adrenal gland, and the blood vessels, particularly the high venual blood vessels, are usually destroyed.
After 5 years program, it is anticipated Uganda will establish a veterinary and biosecurity authority that will constantly monitor the spread of these diseases and build more capacity for the region. Harris Tembo, WBS.